Just go. So welcome everybody to our one more section of our learning series. I just ask everybody to be careful because we are recording and we are live on Facebook. And today we are doing one more series of a learning series. And I'm going to introduce myself first. My name is Vanessa Pollack and I'm a parent consultant with the Connecticut Parent Center. And for those who don't know who we are the Parent Training Information Center for the state of Connecticut. And by law, every state has to have a PTI, and we are the ones for Connecticut. Our mission is to empower families of children with disability and developmental delay, ages 0 to 26, and the professionals who serves them. We provide telephone consultation, trainings, and programs, and our goal is for parents to become their children best advocate, give them the tools that they need to support their children. And today's training, it's about understanding behaviors through the lens of ABA. And our presenter is Alisha Simpson. She's the Executive Clinical Director and Founder of the Collaborative ABA Service. So welcome everybody. If we ask before Alisha introduce herself, if you have any question, we prefer today to you put it in a chat or save for the end, and we're gonna give opportunity to go over your question. So if you're afraid you forgot the question, just put it in a chat and we'll go back to you. And just remember again, for those who just joining us, we're recording and we are live on Facebook. Welcome, Alisha, and you can take it over.
Sure. Hi, everyone. Nice to meet everyone. I am the Executive Clinical Director as well as the founder of Collaborative ABA Services. We're located in Middletown, Connecticut. And today I'm going to be talking about understanding behavior through the lens of ABA. So a little bit about us. Collaborative ABA Services was founded in June 2019. And the purpose of founding Collaborative ABA Services is providing access to quality ABA services. So a little bit about me. As the founder, I am a school social worker as well as a board certified behavior analyst. And in working in the school system with kids with disabilities, we noticed that there was a shortage of ABA services in the area for kids that were diagnosed with autism in particular. And so, the wait list, as you may know, is very lengthy. Some ABA providers have 1 to 2 year wait list to access those services. And, I wanted to help out, and that is why Collaborative ABA Services was founded. We work with children and adolescents ages 3 to 18 with their families impacted by autism and other developmental or behavioral disorders. And we are accredited by the Behavioral Health Center of Excellence, which is a very rigorous accreditation process that a third party comes in and actually looks at our services, and they rate the quality of our services through surveys from our patients as well as through our staff members. And they make sure that the services that we are providing are top standards. And part of our practice, we specialize again in ABA therapy. So our mission and values, we value the importance of partnerships and working together towards a common goal. And in working together, we can mobilize resources and promote meaningful changes in a child's skills and behavior. So we believe in building partnerships, building skills, and also we believe in building futures. So we provide a variety of services. We have a multidisciplinary team of social workers, occupational therapists, board certified behavior analysis. We also have behavior technicians, and we're currently looking to bring on a speech and language pathologist to our team. We provide in-home center-based school and remote ABA therapy. We provide consultations to different school systems, as well as to different organizations. We provide social skills groups, parent training groups, community trainings, assessments, evaluations for autism, case management. We provide professional supervision for students that are in the field looking to become BCBAs in the future, as well as licensed clinical social workers. We provide organizational consulting to different organizational companies, as well as occupational therapy. And again, speech and language is coming soon. So I want to start off before we dive into ABA. There's a picture of, it says, see the world through a different lens, which fits perfectly with our presentation because we're talking about looking at the world a little bit differently through the lens of ABA. So what is ABA? ABA is an approach. It aims to improve the lives of individuals in a socially meaningful way. So basically, we're looking to make a change in the individual's life that means a lot to the child as well as the family. And it is built on the science of behavior. It helps us understand behaviors in regards to how behavior works. So we're looking more at the purpose, or what we call the function of the behavior, as opposed to what the behavior looks like. We're looking at the environmental influences. So what is going on in that environment that might be contributing to that child's or that individual's behavior? And also we look at how learning takes place. So the overall goal of ABA is to decrease challenging behaviors and also to increase replacement behaviors and skills. So why is ABA effective? It's evidence-based, meaning it was based on scientific evidence. There are studies out there that are based on ABA with different populations. There's also, it's useful for teaching a variety of skills. So ABA is used for teaching social skills, language and communication, following directions, self-care, independent skills, academic skills, self-regulation, coping skills, safety skills, almost everything. And I find that in working with our families, a lot of the families do see success in treatment, a lot in social skills, language and communication, as well as those self-care and independent skills are some of the skills that we see in working with our families. In populations that benefit ABA or benefit from ABA, not only is it autism, but there are individuals that have ADHD, OCD, intellectual disabilities, Down syndrome, even typically developing individuals without disabilities, organizations, schools, community providers. So populations that benefit from ABA is literally pretty much everyone. So who can use ABA? So basically anyone with training on how to use these skills can use ABA, including but not limited to teachers, paraprofessionals, parents or caretakers, community service providers. And ABA can be provided in the home setting, school, community, clinic, telehealth. And there are some misconceptions that are out there regarding ABA. So some misconceptions include that ABA is only for children with autism. And as you can see in the previous slide, it's not only for children with autism, but it also benefits typically developing individuals, individuals with different diagnoses such as ADHD or OCD. So it's not just for children with autism. ABA is also not what they call robotic, and all programs are not the same. Each program is individualized based on the learner. And one of the things, or one of the strategies of ABA, and what I really enjoy about ABA, is before we even provide treatment, we do an assessment first to determine what are the skills or what are the presenting concerns that the family has before we develop treatment, which makes it more individualized. Also, it's not only completed at a table. So one of the strategies of ABA is what we call discrete trial instruction or discrete trial training. And that is more table-based, where the child, the behavior technician might ask the child to point to a color or label a color. But it's not only completed at a table. There are other strategies like what we call natural environment teaching, which teaches the child or the individual in their natural environment, such as social skills or play skills. And also ABA uses bribes to promote good behavior is another misconception, and that is not the case. There's a difference between bribery and what we call reinforcement, which I will talk more about later in this presentation in regards to what reinforcement is. The difference in regards to bribery is that the reinforcer or the desired item is given before the desired behavior, as in opposed reinforcement, the desired item or reinforcement, or the item is given after the desired behavior. So how do we use ABA to understand behavior? So there are some core principles of behavior that we look at and that we are founded by. So the first one is, the focus is on observable behavior. Basically, I call it the dead man's test. And what it means is if a dead man can do it, that means it's not behavior. So it's anything that a dead man cannot do is identified as behavior. So like a dead man can't like wave their hand and say hi, for example, that would be considered a behavior. And it reminds me of that movie. I don't know if you guys kind of know this movie. It was like brought up, I think it was like in the 80s. It's like older movie or maybe early 90s. I think it was Weekend at Bernie's, and they had the guys, and the guy had passed away, and they were like pretending he was alive. So they were trying to make him do things that were that actual people do, but they were doing it for him. It kind of brings me back to that movie. The second one is be objective. So what we see versus how we feel. So when we're looking at behavior, we're seeing, a child crying, pulling their hair, throwing objects, as opposed to saying, if someone is looking at a behavior, as opposed to saying, oh, the child is upset or the child is angry, we're able to label those emotions, but what does those emotions look like? The next core principle of ABA is treatment is individualized. So basically, our strategies are adapted to meet the needs of each individual learner. And it kind of goes back to what I was mentioning earlier in the presentation about how we do assessments first to determine the individual child's strengths and limitations. And we use that information to help guide our treatment. The next is the ABCs of behavior. So the ABCs of behavior stands for antecedent, behavior, and consequence. So it looks at why a behavior is occurring. And what it does is it gathers information on what happened immediately before and also immediately after the behavior occurred. So the antecedent, the first of the three of the ABCs, it looks at, again, what immediately occurred before the behavior. And a lot of times when I'm doing an assessment, I always recommend looking at what happened between like those first 7 to 8 seconds of the behavior, because sometimes it could be a lot of stuff that happens. And, if you're able to kind of go back and say, 6, 7, or maybe 8 seconds prior this happened, it kind of helps narrow down some of the triggers to the behaviors. And, an antecedent can also include events such as illnesses, hunger, lack of sleep, or medications. And sometimes we call these setting events because these are things that we can't control. Behavior. Behavior is identified as being observable, influenced by antecedents and consequences. So behavior is neither good or bad in ABA, and it can be changed over time. So it can be influenced again by what happens immediately before the behavior and immediately after the behavior. So consequence, it looks at what immediately occurred after the behavior. Does not always mean a bad thing. It can also be positive consequences. And the effectiveness is determined by future behavior. So did the behavior increase in frequency or decrease? So the next is reinforcement and punishment. So the underlying factors that shape our behaviors. So they're defined by their impact on the future occurrence of behavior. So first we'll talk about reinforcement. Reinforcement is something that increases the chances of a behavior occurring in the future. So this might be praise, compliments, giving money, high fives, removing loud noises, removing pain, or removing non-preferred tasks. Punishment, on the other hand, is something that decreases the chances of a behavior occurring in the future. So that could be something along the lines of, getting a traffic ticket for speeding, getting hit by a ball while walking in the middle of a basketball game, which, if that were to happen, the person probably would be less likely to walk in the middle of a basketball game because they're going to be afraid that they might get hit by the ball in the future. Removing screen time after a tantrum, or charging a fee for late payments is another one. So like, how we all have bills and everything that we have to pay as adults. And, a lot of people want to pay their bills on time because they don't want to get charged that fee, which what it does is it decreases the chances of you paying your bills late. So the functions of behavior. So we look at behavior. So it kind of goes back to the ABCs of what we were talking um, about the antecedent, behavior, and consequence. So the next thing is when we're looking at the impact of the behavior, it also leads to why the behavior is occurring or what we call the functions. So one of the reasons why behavior may occur and when we're using the lens of ABA is attention. So the behavior in this period or in this phrase is allows the individual to get attention from another person. So it's more like socially mediated. The next is escape or avoidance. So when we're looking at escape or avoidance, the behavior allowed the individual to escape or avoid the situation. Access means the behavior allowed the individual to get what they wanted or access, for example, access to a preferred item or activity. And automatic means the behavior is pleasing or feels good to the individual. So a lot of times we see like sensory behaviors, like a person doing something to relieve pain or relieve anxiety. And so these are the four functions that our ABA Foundation utilizes. So again, it goes back to the ABC. So this is a great example of a situation where the function is attention. So in this situation, a parent was playing peekaboo with their child when their phone rang. The parent stopped playing with the child to answer their phone. The behavior is the child starts screaming as the parent is trying to talk on the phone. The consequence was that the parent asked the person on the phone to call them back and comforts their child. The next example is escape or avoidance. So what does escape or avoidance behaviors look like? Here is an example. So an example of escape situation is the teacher hands out a pop quiz. The student begins making loud noises and banging on the desk. So as a consequence, the teacher sends the student to the principal's office. The student actually escapes doing the pop quiz because now they don't have to take it. Avoidance, an example of avoidance would be a parent tells the child to clean up toys in the play area. The child immediately starts screaming, no, no, no. And then what does the parent do? They pick up the toys. So now what happened is that the child avoids picking up the toys, which will increase the chances of the behavior in the future because now the child associates, if I scream no, 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 when mom or dad tells me to clean up the toys, and mom or dad cleans them up for me, then they're more likely going to clean it up in the future. So you may see an increase in the child protesting no. Access. So what does access look like? So an example of access would be the child asks for a parent's cell phone to watch YouTube Kids, and the parent says, not right now. So what does the child do? Starts crying and starts flopping to the floor. So as a consequence, the child gets access to their parent's phone. Automatic. An example of an automatic situation would be mom is exhausted from staying up all night with the baby. So the behavior, mom sleeps. The consequence, mom wakes up refreshed. So mom is more likely gonna take naps throughout the day so that she could feel more refreshed. So what are some clues for determining the functions of behavior? So when we're looking at, for example, attention and determining, which function impacted the behavior, in the attention phase, the attention was previously provided to the individual, then taken away just before the behavior occurred. Kind of going back to the situation with the parent was playing with the kid and then the phone rang and she diverted her attention to the person on the phone. Then the next one is after the behavior occurred, attention was immediately provided. So once the child was screaming and crying and the parent was on the phone, the parent actually got off the phone and then they provided attention to the child. The next clue for escape and avoidance behaviors would be a demand or request is given just before the behavior occurred. And then after the behavior occurred, the demand or request was removed. So that kind of goes back to that example of the child and it was the child or the student that was given the test and then was sent to the principal's office, and then the quiz was removed from them. They didn't have to do it. access, a preferred item or activity was removed just before the behavior occurred. And then after the behavior occurred, the individual was given access to the preferred item or activity. So in another situation where a child wanted the parent's cell phone and, or let's change it, maybe the child had the cell phone and the parent wanted to take the cell phone and said, oh, not right now. And then the child had a tantrum and then the parent gave them the phone. Now all of a sudden they gave them the phone. Now there's no more behaviors. And automatic, the individual was alone or no tasks were given just before the problem occurred, and the behavior occurs across people, settings, and activities. So a good clue for determining automatic or what I call sensory behaviors is when I'm doing an assessment and I notice that the behavior is ongoing regardless of who's present in the environment, it's happening throughout the day, even when there's no demands placed on the child and the child is alone, that can be a sign that the behavior is occurring, could be providing some type of automatic reinforcement. So the next discussion is, how do we use ABA to develop treatment strategies? So with all of this great information, using the ABC data collection, talking about the functions of behavior, how does this relate to treatment? So with treatment in ABA, we try to not only reduce behaviors, but we also want to teach replacement behaviors and also skill deficits, because a lot of times we find that, having behaviors and skill deficits kind of go hand in hand. So what we want to do is try to replace those maladaptive behaviors with more functional and more appropriate behaviors. So strategies for teaching new skills, one of them is the discrete trial training. And it works on skill deficits by presenting a stimulus, waiting for the student's response, and then responding to the child's response with an appropriate consequence. So it teaches new forms of behavior, such as pointing, new speech sounds, and then it also teaches different discriminations to teach those generalization skills across different settings or people and places. So here's an example listed where the provider cues, they say, touch red. And then they prompt the child by physically guiding the child to touch red or modeling touch red. The student responds correctly or incorrectly, and then the consequence is given for a correct or incorrect response. So if the child responds correctly, a lot of times we'll say, oh, good job, and give them like a token if they have a token board. If they respond incorrectly, we may ask them to touch red again. And if they incorrectly touch red, the third time we may ask them and then guide them and help them with the correct answer. And what happens is the RBT, or the registered behavior technician, waits a brief interval, then provides the cue and prompt for the next trial. So this is more structured type of strategy that we use in ABA. And a lot of times it kind of goes back to our misconceptions where, a lot of people say, oh, they just sit at a table. This is just one of the modalities we use. There's different ones. So another modality that we use or strategy is natural environment teaching. So what we do is we teach a skill in the moment that is needed. So it kind of goes back to teaching a child social skills in their classroom setting or at home with their sibling if they struggle with sharing their toys. We try to provide more naturally occurring opportunities that occurred throughout their day. Like another example might be teaching a child to wait in line. So it's easier to teach them in the moment as opposed to, sitting at a table and, trying to teach them waiting in line while sitting at a table. So this is another strategy that we use a lot, and we use it a lot with what we call functional communication or promoting communication skills. Like if we're trying to teach a child to make requests for preferred items or activities, a lot of times students or children learn better when they're playing. So additional strategies for teaching some new skills are pairing. So that is really big. You want to build rapport to increase compliance and instruction and social interaction. So for us, like when we're providing ABA therapy services, the first couple of sessions might be us going into the home and actually, we call it conditioning and pairing, where we're building a relationship with that child, because we find that when you have a positive relationship, it does build or increase in compliance. And it's not only effective with younger kids, but even in working in middle school and high school levels. If that child feels that they can trust you and you have a good relationship with them, they're more likely to follow directives and find you as least aversive. The next strategy we use is modeling. So, we teach skills by actually modeling them. So some of those skills with modeling, I might model for a child that doesn't have any play skills. I might model how to play with blocks, or model how to play with the toy car, because they might not know how to do it. The next strategy we use is prompts. So we provide different levels of assistance, and there's what we call a prompt hierarchy. So there's what we call least to most prompts, which means less intrusive to more intrusive hierarchy of assistance. And what the prompts do is we try to cue the correct response and help them or guide them to eventually where they don't need our assistance and they can do skills independently. Generalization means expanding learning to other locations, people, or materials. So once they master them, we try to generalize those skills to other settings, and that's the best way that the child or the individual can maintain the skills learned. Shaping means teaching approximations of a new skill with practice. Fading means increased independence over time by reducing assistance over time. So it kind of goes hand in hand with what I was mentioning about the prompts or the assistance. And breaking down complex tasks into smaller steps, or what we call a task analysis. So some examples might be, teaching toothbrushing, hand washing, washing clothes, bathing, toileting skills. And when we're doing a task analysis or teaching those type of skills, what we do is we break it down by steps. So like if I were going to teach a child to brush their teeth, I might have a visual of the different steps. And it might be, first we turn on the water, then we grab the toothbrush, then we put toothpaste on the toothbrush, then we brush our teeth, then we rinse, then we spit, then we put the toothbrush away, then we turn off the water. So we try to break it down into smaller, manageable tasks. And we find that it's very effective with our learners because they're able to master each small step to develop a major complex skill. So now there are additional strategies that we use. These are more like the behavior based. So we just talked about like developing skills or teaching new skills. Now we're going to shift over to what we call function based strategies, or more behavior based. So when we're looking at, for example, behaviors maintained by access to preferred items or activities, some strategies we might use might be altering the environment, priming or preparing the child in advance of an activity, using first and then wording, like first clean up, then play, teaching replacement behaviors such as asking for a preferred item or activity, teaching them learning to wait or accepting no, or etc. So strategies for behaviors maintained by attention, some strategies for that might include scheduling adult or peer attention, increasing proximity to the child, providing preferred activity to child when adult is occupied. Because I find that, if there are some children, if the function is attention, when your attention is diverted, that might be a trigger to some behaviors. So when you know that you have to do something different, assign them an easier preferred task or activity, and it kind of occupies them while the adult is unable to provide attention to them at that time. Provide praise and attention for appropriate behaviors, which is great, especially for behaviors maintained by attention, because if the function is attention, the child or the individual is going to do things to get attention, rather it be positive or negative. And what we're doing is we are providing attention, but for desired behaviors. And what happens is the more that we provide attention and praise for the desired behaviors, we're more likely to see more positive behaviors and less negative behaviors. Planned ignoring is another strategy, but I think it's very important because a lot of people might say, oh, I just ignore the behavior, but there's different levels of ignoring. And one of the levels is when there's not a safety concern, it's okay to ignore, for example, the child saying potty words. But in a situation where there is a safety concern, like, for example, the child is bolting out the door, then you definitely want to intervene. It's okay, like, to intervene. However, you're ignoring the child, but not the behavior. And so what that might be is you might block the child from leaving out of the area and redirect them, but you're ignoring the child in regards to you're not speaking to them, you're not engaging in conversation, you're not reprimanding them, you're just physically gently gliding them. So you're addressing the behavior, but you're not addressing the child. The next strategy for attention maintained behavior is teaching replacement behaviors. So again, it goes back to, teaching the kids skills that they have deficits in. So teaching that child to request attention or teaching that child to wait for attention. Behaviors maintained by escape or avoidance. So some strategies here are adjusting difficulty of the demand, offering some choices, incorporating child interest into activities, altering the length of the task. So if we know that a child tends to run away from their desk throughout, like in the classroom setting, after they're given table tasks or activities, maybe what that might mean is maybe we need to modify the length of the activity because it might be too long for them. And part of the strategy might be, instead of making the child sit there for 25 minutes, okay, maybe they do 5 minutes of work, then they get a 3-minute break, they do another 5 minutes of work, then they get a 3-minute break. So we're altering the length of the activity. And also the task also might be that maybe instead of Johnny having to do 20 math problems, maybe Johnny can only do 5 or 10 math problems for right now. So again, we're altering the length of the task, modifying the delivery of the task. So I find that with little ones, using a fun tone can be effective because then they think it's a game and they think it's fun. So for example, it might be that you want the child to go and brush their teeth, and you might say, oh, let's go brush our teeth, I'll race you to go brush our teeth, and then they think that it's a game, so then they run to go brush their teeth. They don't see it more as them having to do a chore or something that they have to do. Change the order of events or activities. So example of that might mean that if we know that Johnny is more cranky in the afternoon and has a hard time with vocabulary in the afternoons at school, it might be more beneficial to say, hey, maybe instead of doing music in the morning time when he's more alert and awake and more in a good mood, maybe we have him do the vocabulary instruction in the morning, and then we switch and do music in the afternoon because of the fact that it's a preferred activity, but also he tends to do a lot better in music as opposed to vocabulary instruction. And also, again, goes back to teaching replacement behavior. So that might mean teaching Johnny how to request a break when he needs a break, as opposed to running out the classroom or running away from his desk. The next strategy listed is for sensory behavior. So again, these are the behaviors that feel great to that person and that can occur throughout the day. So some strategies for that are scheduling sensory activities throughout the day, altering the environment, teach replacement behavior to meet the same sensory need and provide easy access to the replacement behavior. So for example, providing access to appropriate items the child can place in their mouth if they're mouthing non-food items throughout the day. Also, I find when we have children that have a lot of sensory-based needs, it's okay to collaborate. So for example, I may collaborate with our occupational therapist who is trained in sensory integration, who may also have some additional strategies for sensory behaviors as well. So additional resources. For more information about applied behavior analysis, these are just some resources listed here that you guys can check out that talks more about what ABA is. The Autism Helper has a great handout, as well as Autism Speaks has a great handout. And there's also what is applied behavior analysis. It's like a little article from the Center for Parent Education and Resources. So I know that was a lot of information that we kind of talked about in regards to looking at behavior in the lens of ABA. I mean, it's so much to talk about, but I tried to give you guys like a general overview without going overboard. But if you have any questions for me, I am open to any questions that you guys have.
anyone have a question, you can unmute yourself or put it in a chat as well for the people that are watching us on Facebook. We're still here. If you have any question or comment or want to share an experience, feel free to unmute. And if you'd like us email to you the PowerPoint, just put your email in a chat and we'll be glad to forward it to you.
You're muted.
Sorry, I will mute it. Someone asked if it's okay to share with her staff.
Absolutely.
Okay. How do you feel about ABA having two different BTS? Example, one Monday and one Wednesday, another Tuesdays and Thursdays. Like different dates, I think they mean. Is that what you mean, Mark? Two different
hang on, I'll unmute. Like, so for my son, they have the company that we're using right now sends out one worker on Monday, Wednesday, and another worker on Tuesdays and Thursdays. So just to say, how do you feel about that? Because I'm not crazy about it, and that's how supposedly they do their services.
Right, and each agency is different. The positive about having two different BTs is that it teaches generalization skills across different individuals. So whatever skill your child learns with one behavior technician, they're going to learn it with another person. So it helps with generalization of skills. And also in the field of ABA, unfortunately, they do also have shortages in staffing. And so sometimes they may have to assign different staff as well to cover those hours.
Yeah, I understand that. But my other problem is like they try to show me data and it's literally goes up and down, up and down, up and down because each person is recording their data differently. So I'm not getting an accurate representation of like how he is on each day. Like if I had one person's maybe data marked on one sheet and the other person's on a different sheet, I might have a better picture of what's going on. But when one collects data one way and one's collecting it a different way, it looks like his graph goes up and down every other day. Does that make sense?
Yeah, so one of the components of the ABA program is BCBA supervision. So usually the board certified behavior analyst who oversees the case normally comes out and they're supposed to supervise a certain percentage of hours worked by the behavior technician. So normally you might see them once a week, or you might see them once every 2 weeks, depending on the number of hours that are authorized with your insurance and how many hours the behavior technician are working. And what the BCBA does is they analyze those data points. And what they do is if they notice that like your child is not mastering certain goals, then what the BCBA does is then they go back and they kind of see, is it because of the difference in behavior technicians? Is it because he wasn't feeling well? And then that BCBA also uses that data to determine, what next treatment step should be. Rather, that means they need to modify that program or they need to discontinue it and work on another skill. And also sometimes too, with data, it can go up and down, up and down. It's just a matter of what the criteria is or the mastery is. And I believe with the BCBA, I would recommend definitely reaching out to that BCBA that's assigned to you that oversees the behavior technicians to definitely talk about the data. And she can, and usually what the BCBAs do too, as well as they do fidelity checks. So they also, when they're providing supervision, they're monitoring if the implementation of the programming is being done with fidelity by the behavior technicians.
Does that answer your question, Mary?
Yes, thank you.
Sorry, I gave you like a whole earful.
Hi. It's Gloria, Dale Davis. I'm just trying to find out because I know that through my program and I'm listening to what Mary is saying and I probably will agree with her because it is two people that are doing this data. And unfortunately, what I found in my program is that the expectations for different people are different. So one person may allow a child to go to number 7 before they intervene, where there's another one that may go to number 4 before they intervene. So could this affect that child's behavior because of the expectations from two different people? And I've noticed that because I have them in 2 different programs and 2 are completely different as far as their expectations and what's acceptable and what's not acceptable before they kind of reel them back in.
Yes. So part of it kind of goes back to the BCBA, the supervisor of that case. And for each child that has behavior concerns, there should be a functional behavior assessment and a behavior intervention plan developed. And once they develop that behavior intervention plan, it should be shared with the parent as well as shared with the behavior technician so that they're all on the same page. And that BCBA is expected to train the staff as well as the parent on implementation of that behavior plan. And what happens is when they come out and do their supervision sessions, one of the things that they should be looking for is rather those treatment plans are being done with fidelity. And if not, then they end up training their staff and modifying to fix those errors. So I would recommend definitely reaching out to the BCBA and just letting her know like your concerns, and then she would be able to follow up with those behavior technicians and review his behavior plan.
Okay, thank you.
Mm-hmm.
Anyone else has any question, want to share something? They're so talkative today.
Right. Don't ever hold your keys.
Don't fight, don't fight. We have space for everybody.
It's after dinner time.
Oh, everybody's like, or after work, everybody's like kind of like checking out, like it's close to that 7 o'clock mark.
And if anybody wants to have the PowerPoints, just please put your email in a chat so I can get it and make sure I get it for you before we end this. But I guess if no one have any question for Alisha, I'm gonna, oh, someone put their email there. I'll get to you as soon as I have it, Gloria. And thank you for everybody to join us tonight on this lovely presentation. Thank you, Alisha, for being here with us. I'm gonna stop our live. And thank you everybody for